Doctor, would you please explain exactly what interventional pain management is?
Well, interventional pain management actually means that you will find some type of intervention to alleviate pain that does not require the oral use of a medication. You can do certain injections of local anesthetic, injection of steroid into the affected structures. You can do ablations of nerves that can transmit pain. For example, somebody with pancreatic cancer might benefit from a celiac plexus neurolysis, which is destruction of some nerves that transmit pain from the pancreas. So you do different types of injections directed to the affected tissue in an attempt to alleviate pain.
Sounds like a great middle road here, because if a patient comes in and after speaking to the patient and hearing about their pain, if it's not to that excruciating side, yet you know you have something to deal with here, this sounds like that great middle road where maybe you can at least try it for a little while, and maybe you can, and I don't want to make light, but kind of get away with something a little less than being so invasive.
Absolutely. And it can be quite effective. Again, it all depends on the diagnosis of the patient and the affected part of the body. You don't have nerve blocks for everything, but there are certain types of painful conditions that respond to targeted injections into the tissue, and that's what we mean by interventional pain management.
The injections themselves, when, or give us an idea of your decision-making process in using injections to block the pain.
Well, it's always my first choice whenever I'm presented with a patient that has a painful condition that will respond to an injection. So if I see someone for the first time in my office that has pancreatic cancer, I know he's in my office for the pain. He's not in my office for the cancer. So my first choice is going to be to suggest a celiac plexus block that can provide long-lasting relief versus having to bump up or increase their medication use, which can lead to side effects.